Hello, everyone, and welcome to episode 44 of the Pet Behavior Chat. And we're going to chat all about canine house soiling today. So next week, we're going to do feline house soiling, but I'm going to get us started off with canine house soiling today. And the reason I want to touch on these two topics is because they're hugely important in veterinary behavior medicine, because a lot of time these behaviors can lead to relinquishment or even euthanasia of those animals. So I think it's really important to chat through, what might be causing these issues and to give a bit of an overview of the topic. So we're going to start with canine house soiling today. I'm going to start off just by running you through some milestones of kind of puppy development and, when they should be doing what in terms of elimination behaviors. Then I'm going to give you the way that I look at canine house soiling, kind of the three big silos that I look at. And then I'm going to finish us off with just what's in the literature about canine house soiling and what that tells us and how that informs us. All right, so let's get started by how prevalent actually is this problem. So how commonly does it occur? Is it something that happens frequently? How many dogs in the sort of general population house soil? And it depends on your population, obviously, and it depends on the study that you read. But anywhere between 2 and 9% of dogs that were presented to a veterinary behavior clinic, a specialty clinic, were presented for house soiling. So somewhere between, 2 and 9%. So it's not a huge problem. I think probably not quite as prevalent as in cats, but still something that we need to take into consideration, because I think it impacts lives massively, whether that's the life of the caregiver or the life of the dogs themselves. Okay, so let's chat about some of these milestones. So what do we expect in a normal sort of puppy development in terms of how their elimination develops, and then also what that means in terms of them perhaps moving into a home when they are puppies. So the first thing to know is that puppies don't spontaneously eliminate until they're about 3 weeks of age. So before the age of 3 weeks, we heavily rely on mum, or if mum's not around, then we need to kind of manually stimulate them to urinate and to defecate. And mum does that by kind of licking around their perianal area, and that stimulates them to urinate and to defecate. At the age of around 3 weeks, they start to what we call spontaneously eliminate, so they can do it without mum's stimulation. And around the same time, sort of between 3 to 4 weeks of age, they actually leave their nests or their sleeping areas to eliminate outside of that. But at the beginning, that can be many, many different areas and many different locations. At around 5 weeks of age, they start to kind of select a general area, somewhere that they prefer to eliminate. So that happens at around 5 weeks of age. And then at around 9 weeks of age is when they develop preferences for specific locations and also specific substrates. And this is really important, because usually that time up to around 9 weeks of age, hopefully, is actually the time that they still spend with the breeder or with their mums. And it's not until that sort of age that they actually come into our homes. So at the time they come into our homes, they may have already developed preferences for where they prefer to eliminate and what kind of substrates. And by substrate, I mean, do they prefer to eliminate on grass or on concrete? Or, maybe they've been taught to eliminate on a pee pad or a puppy pad. And by area, I mean inside versus outside. So all those sorts of things start to become important at around 9 weeks of age. And so when we think about where some of these puppies are raised, for example, in large breed or large scale breeding operations, or maybe pet shops, then that kind of substrate preference develops purely because that's what they have access to, right? So if they're in a large scale breeding operation where they only have concrete pens to eliminate on, that is then naturally going to become their preferred substrate to eliminate on. So if you want your puppy to eliminate on grass, then, it's something that you might want to communicate to the breeder. Hey, can you start maybe, putting them out in a grassy area if that's appropriate, if that's the kind of substrate preference that you would like to have, or you would like them to have in the future. So this is not always easy. And I think sometimes also this is where, issues arise when we have puppies that come from shelters, because they may really only have had access to sort of concrete or runs or something like that. And sometimes changing that substrate and location preference for them can be quite challenging. And I know that my sister, they went through that same problem when they adopted a dog from a shelter, is that, she didn't really know anything else other than eliminating on either concrete or tiled floor. She didn't really understand anything about eliminating outside or on grass or in the sand. So those are things that can really have an influence. So I think it's really important that we understand, normal behavior in order for us to be able to set realistic expectations, especially when we're bringing a puppy into the home. Now, the other thing that we need to really think about is they don't develop control over their bladder and their bowels until a little bit later. And we're talking sort of 4 to 6 months here. So that kind of how long can they hold it for piece, that probably doesn't come into play until they're about, 4 to 6 months of age. And we have kind of a general rule of thumb, although this is not always obviously appropriate for each dog, but it's usually kind of the age in months is roughly the number of hours that they can hold it for. So if you've got a puppy that's 4 months old, they might be able to sort of hold their bladder and their bowels for maybe 3 to 4 hours. And as they get older, that sort of increases by hour the older they get. So just something to think about, in terms of if we're getting a new dog, we need to figure out what can we actually realistically expect from them in terms of what their past has been. If we're getting an older dog, maybe if we're rescuing a dog from shelter, or certainly if we're getting a puppy, we need to know those things so that we can set realistic expectations and we're not tempted to kind of punish them for things that are just completely normal for their developmental phase. Not that we ever want to punish dogs for eliminating in the house, but obviously that's something that does happen. So that's, I think it's just important to mention that. Okay, so what are the most common causes then of canine house soiling? And this is where I have sort of 3 big boxes that I think about, 3 big silos when I think about, kind of getting a diagnosis and thinking about what the cause of the house soiling might be. The first one is physical medical. Always have to go there first. So is there a physical medical reason why the dog either is house soiling or maybe has started house soiling? So certainly if they've always been, perfectly house trained and have always eliminated outside maybe or in the area that you want them to, and all of a sudden that changes, then one of the things we have to consider is physical health. And there can be a million different reasons for why physical health reasons why that might be happening. Certainly as dogs get older, we're thinking about canine cognitive dysfunction. So that kind of loss of learning or loss of house training, that can be part of that. But it could also be, as they get older, be due to mobility issues. So imagine if a dog has to go down, some steep steps out into the garden and they are suffering from chronic arthritis, osteoarthritis that's becoming more and more painful, then they may not want to go down those flights of steep steps to get to that place. And then they might decide to eliminate in the house instead. So mobility, I think, is a massive piece to think about. And even sometimes just the physical act of putting themselves in that position, maybe squatting to defecate or lifting their leg to urinate, can become much more difficult as they get older. So that's something to think about. Do we need to think about pain or address mobility issues? And of course, there can be lots of other physical medical things to consider. Incontinence is something that we for sure want to think about here. So that's being really observant of the dog and looking at do we have incontinence or sort of unconscious urine leaking? So, maybe that needs to be addressed. That could also have a number of different causes. Or do we have sort of actual voluntary elimination, but just in the house as opposed to outside? Metabolic diseases can be a big factor here. If your dog has a metabolic disease, let's say we're talking about diabetes, or maybe Cushing's disease, or maybe kidney disease that are causing them to drink more, then they're also probably going to urinate more. And that can definitely be a cause for house soiling. If we're talking about defecation, so pooping in the house, then we're looking at things like gastrointestinal disease. We need to consider, has their stool changed? What does their stool look like? Could there be an underlying cause for that? And very often we have maybe food sensitivities. We might have other gastrointestinal disease, such as inflammatory bowel disease or pancreatic disease. There can be a number of things that could be underlying that. But it's really, really, really important that we consider physical disease, because again, unless we address that, and unless that gets the necessary investigation and potentially treatment, then we're not going to be able to address the behavioral side, which is the actual house soiling. So that's my first big silo. That's physical, medical, and I think we should always go there first, no matter what. I think it's really important that we consider that. Okay, the second big piece is loss of house training, or maybe it wasn't house trained properly in the first place. And that's a big one. And actually, when we come to talk about the literature later, that was the biggest presenting problem in one paper. It's an older paper, and I'll talk about it in a little bit more detail a little bit later on. But incomplete house training is definitely a big thing. Now, that could be, incomplete house training as a puppy, or could be loss of house training. And the loss of house training, again, can happen through a number of different things. Canine cognitive dysfunction being right up there. Maybe there was a change in environment, or maybe all of a sudden we've had a change in inadvertently rewarding or reinforcing elimination in the wrong place. So either, in the house instead of outside of the home. But that's a massive piece. And obviously, for anybody who's ever had a new puppy, we all know how important that those first months are in terms of getting that house training piece right. And we have some beautiful resources on our Trinity website. We've got a bit of a puppy house training guide on there, 2 different documents. So I'm going to put the link to the Trinity website in the show notes, and you can go to the free resources page and download that if you're interested. We've also got a little daily checklist for the things that you need to consider. But for sure, when you're thinking about, first house training a puppy, you want to think about, where do you want them to eliminate in the future? If you're living in a house with a garden, do you want that to be in the garden? Do you want that to be in a specific area of the garden? Do you want that to be just outside of the home in general on walks? If you're living in an apartment, do you have a specific area that you would like them to always eliminate? That might be on a balcony with some fake grass or a pea pad. So it's really important that you consider both the location and the substrate. Those things are both really important to dogs. And that you then always, always, always reinforce them for eliminating in the right place. And you never, ever, ever scold them or punish them for doing it in the wrong place. So if you do have an accident, you just ignore it, and you try and figure out why that happened, or how you can change things up to make the likelihood higher that the dog's going to eliminate in the right place. And then, of course, we reinforce, we reward, and we praise, and we make sure that they understand that this is where we would like them to eliminate. So that's a really big piece. And of course, with puppies, with young puppies, we just talked about that whole kind of bladder control piece and bowel control piece. In the beginning, you're going to have to give them the opportunity to eliminate frequently. So that means, allowing them access or taking them out, let's say, into the garden, probably every hour to start off with, and then making sure you reinforce them if they have eliminated outside. So under this piece also, I would put management challenges or inappropriate management. So that could be as simple as just leaving the dog, home alone for too long, and not giving them access to the outdoors or where you want them to eliminate often enough. So those management pieces, even once they're fully house trained, you want to make sure they have access to the right place. And you'd be surprised at how often that actually pops up. Is all of a sudden we realize that, whoa, they haven't had access to the preferred elimination place often enough. And once we change that and we give them access more often, then, all of a sudden the house soiling is resolved. So that's a really, really important piece. So making sure you train them correctly. And again, this applies to puppies, but it also perhaps applies to a dog that's been rescued from a shelter. And that management piece, making sure they've got every opportunity to do the right thing. And that's down to us a lot of the time as well. So that's the second big silo is it just incomplete house training? And the way I often ask the questions I ask of my clients to try and understand that is, do they have an ask? Are they able to ask you to be let out? Can they make it clear that they need to go to their elimination spot? And if they have that ask, then it's usually quite clear that the training is there or that the learning piece is there. But sometimes, things can be just very, very confusing for them, especially. So here in the UAE, we have a lot of different caregivers. You might have the actual clients, the owners of the dog, but you might have a myriad of different people that are actually the primary caretakers or the sort of everyday caretakers, nannies, maids, walkers, drivers, whoever that might be. And if everybody has a different approach to things, the poor animal is going to get completely confused. So consistency is a really, really important piece here. Clarity, consistency, making sure you define clearly where you want the dog to eliminate and you don't then kind of change your mind. Okay. And then the final silo, the third silo, is behavior. So are there behavioral ill health reasons that they might be eliminating in the home? And there are a number of different ones here. And I'm going to start off with a behavior that is actually a completely normal behavior, and that's urine marking. So urine marking is different from voiding your bladder, emptying your bladder. Urine marking has a communication piece in there. Urine marking is usually done more by male dogs. So that would be potentially depositing small bits of urine on maybe vertical surfaces. So kind of, going all over the place and lifting their leg to pee. And urine marking can, like I say, be a normal sort of marking behavior, but sometimes we can have increased urine marking also due to stress, due to a feeling of lack of safety in the environment and needing to kind of put their urine marks everywhere in order to feel a little bit safer. Now, urine marking is an interesting one because potentially there might be a surgical option here. However, literature shows us that probably only about 50% of dogs actually stop urine marking after castration. So it's not an immediate fix. It's different in cats. The number there is different. It's much higher. But in dogs, we've got that number is probably around 50%. And around 30% of the dogs, so about half of that 50%, can improve very, very quickly after castration, and the other half is more slow after castration. So, and again, it depends on, I think it depends on sort of the underlying motivation. If we've got urine marking as a result of anxiety or stress, then probably castration is less likely to help. If we have urine marking as a truly sexually dimorphic behavior, kind of a male dog behavior, then maybe urine marking is more likely to be helpful. However, it's really important that you inform your clients, if you're a vet, that you make sure that they know, hey, there's only potentially a 50% chance that this might work. I think that's a very, very important communication piece here. Okay, so that's urine marking. And then we have a whole array of other behavioral potential factors that might be causing house soiling. So one of the kind of interesting ones, I guess, is urination due to excitement or maybe conflict. And yeah, that's one that we see relatively frequently, perhaps as part of a more generalized anxiety disorder or a more generalized sort of fear conflict behavior. And by conflict behavior, I mean sort of a conflicted relationship or uncertainty for the dog in the relationship that he has with the main caregivers. So, we may see the dog kind of urinating, maybe even while going into a sort of a submissive or defensive posture, lying down on their side and kind of half rolling, maybe with their elbow tucked in, might urinate there. Could be at a time of greeting or whenever perhaps the caregiver approaches to give physical interaction. So that is a sign that there's probably a bit of a breakdown in the relationship there, and a breakdown in trust. And that might go hand in hand with maybe also fear aggressive behaviors or conflict related aggressive behaviors. So urination can sometimes be a sign that there's a bigger picture issue present. And then sometimes we have excitement urination. This tends to happen more in younger dogs. It's really important that we kind of piece out, is it true excitement and, we're urinating because we're excited and happy, or is it rather that kind of conflict piece or that sort of worry piece about interactions with caregivers? So that's the one piece. And then we have a couple of other sort of really big pieces when it comes to behavioral ill health. So separation anxiety or separation related behaviors is a big one. So we know that one of the kind of classic signs of separation related behaviors is either urination and or defecation in the home when left home alone. So that's a big piece. So if we find that the dog is urinating and or defecating in the home, but it only happens when they're home alone, when the owners are away, then that can be a clear indication for separation related behaviors or separation anxiety, potentially noise phobias, noise fears, noise sensitivities. That absolutely can also be, urination and or defecation can be a sign there. They just get so scared that they kind of pee or poop. We can have confinement related fears, anxieties, stressors. So when they're confined, they might urinate or defecate. And again, this is an interesting one because we usually don't see elimination close to a sleeping area. Remember I said that at around 3 to 4 weeks of age, they start to leave their sleeping areas to eliminate away from them. So their normal behavior would be to eliminate away from a sleeping area. So if they eliminate in their crate, if they're confined to a crate and they eliminate in there, then that could be due to stress of confinement. That's a quite a complicated issue when they eliminate in their crates, and that needs quite a detailed workup. But yeah, so that confinement piece could definitely be a piece. And then, we might have generalized anxiety disorder. We might have a global fear of going outside. So the dog might be really fearful of leaving the home, going outside. And if that's where you want them to eliminate, that they might not do that. And I have a number of cases where the dogs will absolutely not eliminate out on a walk. If you imagine putting yourself, especially in that sort of position to defecate, leaves you quite vulnerable. And if you're already very fearful of the outside world, then you're highly unlikely to eliminate there if you're a dog. So that's something to consider as well. So generalized anxiety disorders, global fears, fears of leaving the home, all those things need to be considered there, definitely. So we could probably go on a little bit more, but just to say that I think if you have any doubt that there is a component of anxiety or a behavioral health, ill health disorder, then you absolutely want to seek the help of a professional. You probably want to seek the help of a veterinary behaviorist because they can address all the things that I've just talked about. So they can look at the physical health, they can address the learning side of things, they can address the management side of things, and we can also obviously address the underlying fear, anxiety, stress, conflict, panic, whatever it might be that is underlying those behaviors. So those are my three big silos. And I always find when I'm presented with a canine house soiling case, I go there because, you want to understand and you want to get some clarity about what's going on. I think oftentimes these problem behaviors can be fraught with a lot of emotionality or emotional coloring from the side of the owner or the caregiver, because obviously it's extremely frustrating for them when their dogs are eliminating in the house. And that kind of not knowing why is this happening, what's going on piece can bring a lot of emotionality with it. And like I say, it's oftentimes a cause for relinquishment or even euthanasia, especially when we're talking about cats, which we'll be talking about next week. So being able to help a client in this situation could be the difference between life and death for that dog. So it's a really important piece to know about. And I think certainly for my brain, it helps to be able to kind of have a few compartments and to think about, hang on, is this a physical health issue? Is this a lack of house training, is there a learning component or a loss of learning component here, or is the dog being inadvertently reinforced or rewarded for eliminating in the wrong place? And then the final piece obviously is looking at that kind of emotional ill health and the emotional piece to it. So those are my three big silos. I think I've touched on pretty much everything. So I just want to touch on the literature. That was the last piece. So there's not a lot, is my simple answer to that. There's not a lot in the literature. There was a great paper by Yeon and Dr. Haupt, it's an old one, 1999. So it's an older one. And they looked at the prevalence of house soiling cases in their hospital. Now, again, that was sort of an isolated population that presented to a referral behavior hospital. And they saw around 9% of cases presented to them were canine house soiling cases. And they actually found that around over 80% of dogs that presented for house soiling had a lack of house training, lack or loss of training. So that's really important to know, because it could be as simple as, in inverted commas, retraining the dogs or properly training them that could really, make a massive difference. And they found that, giving them the correct advice actually caused improvement in over 80% of cases again. So big. The second biggest population for them were dogs with separation anxiety. So around 40% of dogs that presented for house soiling had separation anxiety. So those were the two biggies that they found. But they did actually find that, giving the right kind of advice and the retraining and the learning piece made a massive difference and really helped these cases, which is great because, in veterinary behavior medicine, being able to affect a positive change in 80% of cases is not something, that is easily done. So that's great. We have another more recent paper, I think from 2022 by Dr. Amy Learn. She looked at differences in the size of dogs. So there was always, I think, a little bit of an idea that small breed dogs are more difficult to house train. So they looked at that in their paper, and they did actually find that, yes, small dogs are a little bit more difficult to house train. They didn't, I guess, come up with any explanations, but there were a few sort of purported reasons why, and potentially the smaller bladder size was one of them. So yes, small breed dogs, according to this paper, were more difficult to house train than larger dogs. So if you do have a small breed dog, and especially a puppy of a small breed dog, be very, very aware that it's going to probably be a little bit more difficult to get that initial house training piece done. And that's likely just because they maybe, don't have the ability to hold their bladders for a long period of time. So you might be taking those guys out every 30 to 60 minutes initially to make sure that you start building those really good associations. So that's those are the two papers that we have. There are more, but those are the two papers that I'm going to talk about here. And then we've got one really interesting paper by Gazzano et al., I think from 2008, that paper was, which actually talks about providing advice to puppy owners. So the study was about a veterinary behaviorist providing some kind of general, behavioral advice to new puppy owners, including toilet training and how to best kind of manage that, and providing some of the sort of advice, I guess, that I've given today, what's realistic to expect, how best do we go about training them. And just the mere fact of the advice being provided to puppy owners, and new dog owners caused, and they sort of followed up with those puppies or dogs, I think a year later, and actually showed that those dogs that received advice had a much, much lower incidence of problems, including house soiling. So providing, if you're a vet listening or a vet nurse listening, providing some really basic initial advice and facts and help and support about toilet training to puppy owners and to maybe clients that have, adopted a dog from a shelter will go a massive way to preventing those problems from arising. And again, when we think about sort of relinquishment numbers and euthanasia numbers, that due to behavior problems, including house soiling, that's a massive impact that we can have on many, many dogs' lives. All right, that was my whistle-stop tour. I'm going to link the papers that I've mentioned in the show notes, the two papers, so the Yeon and Hout and as well as the Amy Learn paper. I'm going to link those in the show notes, and we're also going to link the Trinity website, the free resources page that has the house training documents on there. We're going to link those in the show notes. So for anybody who's interested in that, please go ahead and make use of those free resources or read the papers if you're interested. And yeah, that's how I think about canine house soiling. So I hope that's been helpful. Obviously, there's quite a lot more to discuss, and we might dig deeper into some of those silos in future episodes. So maybe a little bit more about the house training piece, and a little bit maybe more about the sort of the mental and emotional piece. So yeah, that's those are things to come for future episodes. But that was my kind of big overview whistle-stop tour. I hope you found that helpful. Please leave me a comment if you have any questions, or if you have any comments about the episode. And I look forward to seeing you guys next week for episode 45, which will be all about feline house soiling. All right, that's all for now. Thank you so much for listening. Bye.